Alright, so we have pyomyositis, keratitis, and myocarditis.
What do you guys think?
I'm not sure. It could be a combination of the three.
I think it's more likely to be parotitis considering his recent fever and swollen lymph nodes.
What about myocarditis? His heart rate is unusually high.
Hold up, you all are way off. The real diagnosis here is lethal congenital contracture syndrome. Don't question me, just do what I say.
Dr. Hawks, we have our own expertise too.
I'm supposed to weigh your expertise of failing a circus clown audition against my expertise of saving lives.
Try again.
We can't ignore the symptoms of pyomyositis and parotitis completely.
Enough. You're all dismissed. Leslie Randall, Frank, you are to perform a radical mastectomy on this patient immediately.
But Dr. Hawks, that's extremely risky.
It could lead to severe complications.
The patient may not survive the procedure, sir.
Silence. The risk is worth it. I am the doctor here and my judgment prevails. I don't see what the problem is, Tracy.
The problem is that you're suggesting a radical mastectomy for a patient who might have lethal congenital contracture syndrome.
And I've been doing this for years. I know exactly what I'm doing.
Actually, you've got it wrong more often than not. You're always trying to find the quick fix rather than treating the underlying problem.
That's enough of your negativity. Let's focus on the patient we have right now. This isn't about past mistakes or my track record. It's about doing what's best for this patient today.
But that's exactly what I'm saying, Hawks. We should focus more on treating the underlying problem rather than always reaching for radical solutions.
It's not a solution if it saves their life, Tracy. What's so wrong with that?
What's wrong is that we've got a track record of overtreating and underdiagnosing. We need to think about the long-term consequences and patient safety, not just saving them in the short term.
You're talking about patients like they're experiments rather than individuals. We have years of data that supports radical mastectomy as an effective treatment for lethal congenital contracture syndrome. I'm not lying to you, Tracy.
That's where you're wrong, Hawks. It's not just about the numbers or the data. It's about understanding and treating patients holistically.
You're a doctor too, Tracy. You should know better than to question my expertise on this matter.
I didn't know better, Hawks. And that's why I'm asking you to reconsider your approach.
I have to admit I was shocked when Dr. Hawks insisted on a radical mastectomy for the patient's condition.
I'm sorry to say this, but the fact is that particular operation wasn't going to solve anything.
Indeed. And it seems we've only managed to make things worse.
Now, instead of dealing with the lethal congenital contracture syndrome, the patient is also battling infection and pain from an unnecessary surgery.
It's like being hit by a truck and then having the impact delayed by a couple more days, you know?
I understand your frustration. We're here to find the best possible treatment for you. And I believe it doesn't end with another surgical procedure. Let's look into alternative methods.
Alternative? What are those alternatives?
Well, there's a new form of physical therapy that could possibly help. It's experimental, but some promising results have been seen so far.
If this involves the patient crawling on all fours throughout the hospital, I don't want to hear it. We got to bring this up to Hawks.
You morons. How many times do I have to tell you all that Lux is not a diagnosis for a goddamn breast tumor? You're lucky the patient survived, you incompetent sons of bitches.
Dr. Hawks, we know it was a mistake. We just want to know what the actual diagnosis might be.
Yeah, I mean, it's clear now that radical mastectomy is not the treatment for this condition. What do you suggest?
We're sorry, Dr. Hawks. We were wrong and we'll make sure not to repeat our mistake in the future.
You'd better hope so. You four are a goddamn embarrassment to the field of diagnostic medicine. Go figure out what this patient actually has. How are things going over at the oncology department? You've been looking a bit stressed out lately.
Oh, it's just one of those days where everything seems to go wrong. I have this patient who is really struggling with her treatments, and she's starting to lose hope. It's hard to see someone so strong slowly give up like that.
Have you suggested that they get on hospice care already and just get it over with?
That's a bit harsh.
I know, but life sucks. Now, if only we could find a solution for my patient's peculiar condition.
Maybe you suggest they get a more qualified second opinion and get it over with.
Screw you. What's taking so long? We have a patient here who needs surgery.
Hawks, you know you can't just barge into an operating room like this without proper protective medical equipment. You're putting yourself and others at risk.
And you're wasting our time with your unprofessional behavior.
We've been trying to get through this surgery for hours already. Just let us do our job, Hawks.
You'll understand when you hear the diagnosis. Lethal congenital contracture syndrome was wrong. I have a new one. Kikuchi disease.
Kikuchi. Disease. What's that?
And how did you come up with this diagnosis without any proper examination?
It seems like it'll be another day of chaos and confusion around here, with Hawks's impromptu diagnoses.
You all will understand when you hear the prognosis. Kikuchi disease is a benign condition, but we need to treat it immediately.
A benign condition? So what's your treatment plan?
We'll have to review this diagnosis and get more information before making any decisions.
But for now, let's focus on the patient in front of us. We can discuss your new diagnosis later.
You all will understand when you hear the prognosis. Kikuchi disease is a benign condition, but we need to treat it immediately. I'm glad you got that right diagnosis for the patient. You're a top-notch doctor, no doubt about it.
Don't kiss my ass. I know you're trying to avoid being yelled at for suggesting that one of Johnson's patients just goes on hospice and dies already.
To be fair, we're all thinking it.
No, we weren't. That patient you were referring to has a fairly treatable form of cancer, and you were telling them to give up.
I said no such thing. I suggested they go on hospice care because they're losing hope anyway. I thought this would scare them into realizing they can stop throwing a pity party for themselves. Like, boo-hoo. I have a benign tumor swimming next to my testicle. It's probably not even a tumor. I'll bet it's a hernia from when he was doing all the heavy lifting to seek attention towards himself.
Hawks, no more suggesting to Johnson what his patients should be doing.
Oh, so screw my lunch talks. We have literally nothing else to talk about at lunch? Am I supposed to feed my face without listening to some sob story so I can remember what's wrong with my patient?